A number of people this week have asked about how to really maximize their blood sugar control in relation to diabetes. And of course the number one way is to very, very strictly follow my low GL diet. That is the most important, combining protein with carbohydrate, having the right portion sizes of carbohydrates in meals, and eating more little and often. Now, you can improve blood sugar control by enhancing how the insulin receptor works, and it depends on chromium. Now, in studies on diabetes, the most effective dose of chromium is about 600 micrograms, and most chromium pills are 200 micrograms. Now, cinnamon also works. There's something in cinnamon called MCHP. You find it very highly concentrated in an extract of cinnamon called sinulin. So if you can get chromium with sinulin, that is excellent. The amount of cinnamon that works is about 6 grams, which is a lot, a heaped teaspoon. However, the sinulin form is 10 times more potent. So in other words, it would be 600 milligrams. What I actually recommend people to have is 300 milligrams of sinulin and 3 grams, that is half a teaspoon of cinnamon every day. For example, in my breakfast this morning, I had Get Up and Go, which is low GL, protein and carbohydrate with some berries, and I also put in half a teaspoon of cinnamon. Now, the other thing that makes a big difference are the super soluble fibers based on glucomannan. And if you have about 3 grams, which again is about half a teaspoon or 3 capsules of glucomannan, with a large glass of water, or medium glass of water, because it absorbs a lot of fluid, just before each main meal, so 3 times a day, that lowers the GL, that stabilizes your blood sugar, that means you need to produce less insulin, so that really works. Also, there's growing evidence that a lot of antioxidants, if we use that category term, have significant effects on blood sugar control, especially in diabetes. And this includes vitamin C, it includes resveratrol, alpha-lipoic acid. So you really want to pick a kind of all-round antioxidant formula that contains all the antioxidants that have been shown to have an effect. Now, all of this is in my book, Say No to Diabetes. And I would give just one word of caution, and that is that if you have type 1 diabetes or you are using insulin on insulin medication for type 2, then how you phase in the diet and the supplements is very, very important. And the reason for that is that if you do it all at once, it can be so effective that in effect you need less insulin, so the insulin dose you're having gives you a hypo, which is not good news. So in the book I do explain very clearly how to phase in these changes. But all of these general principles are excellent for everyone. You don't need to have high dose chromium and so on if you're not diabetic, but they are very good principles for keeping your blood sugar dead even, and that will help with weight control, it will help with energy, it will help with mood, and of course it reduces the risk in the future of diabetes, heart disease and many other diseases.